Hi, my name is Jennifer Cannon. I'm presenting the Baby K case for my ethical presentation. Baby K was born Stephanie Keene on October 13th, 1992. Mother was known in this case as Miss H. She was young, and because of the notoriety of the case, she wanted to remain anonymous. This took place at Fairfax Hospital in Northern Virginia. Early on in her pregnancy, Baby K was diagnosed with anencephaly, which is a result of a neural tube defect. When minimal brain tissue develops, often only the brain stem is present and the absence of skull bones. The mother was given this prognosis. Only 55% of these children are stillborn, and most of them don't make it until hours or days after birth. The mother did not want to accept this diagnosis and wanted everything done. She would not sign a DNR. So her pregnancy went on. At the birth, Baby K was placed on a ventilator. The hospital again tried to have the mother sign a DNR, which she refused. She wanted all care to be done. By 6 weeks, Baby K was weaned off the ventilator, and Fairfax Hospital attempted to transfer Baby K to another hospital because they felt that this care was unethical. Other hospitals refused to accept transfer of her, and finally had the mother agree to nursing home placement on the agreement that if she needed to return to the hospital for care, that they would accept her. Baby K returned several times to the hospital for respiratory distress and apnea. On her third visit, at 6 months old, a tracheostomy was placed, and the hospital filed a motion in court to attempt to have a medical guardian other than the mother placed for her, and care to be only palliative, to stop all aggressive care. The mother's lawyer filed a motion stating that this was in violation of the EMTALA Act, which is Emergency Medical Treatment and Labor Act, the Rehabilitation Act of 1973, the Americans with Disabilities Act, Child Abuse Amendments of 1984, and the Virginia Medical Malpractice Act. The Fourth United States Circuit Court of Appeals heard this case and deemed that respiratory distress, not anencephaly, was the medical emergency that Baby K was suffering from. The hospital filed to have an exemption written for the EMTALA law, which states that all care is given to any patient regardless of what they come in for or ability to pay. On February 10th, 1994, the court decided that the hospital could not ignore this law, and it was made to not have exemptions placed on it, and that they would need to continue care for Baby K regardless. Baby K spent months in the PICU, often on the ventilator for respiratory distress and apnea. In April of 1995, Baby K died of cardiac arrest at 2.5 years old. The ethical dilemma in this case was brought about: is it appropriate for the physician or hospital to deem medical care futile to patients with a terminal diagnosis? Miss H's argument was that God, not other humans, should decide the moment of her daughter's death, and that she had the right to decide what is in her child's best interest. Thank you.